Greetings, my name is Monique Amos, and I'm a student pursuing a Master of Public Health in the Claremont Graduate University's School of Community and Global Health. Today, I will be presenting Addressing the Disease Burden of Maternal Mortality. After considerable progress in recent decades, a 2023 study from the World Health Organization, or the WHO, revealed that maternal mortality and morbidity either stagnated or worsened in most regions of the world between 2016 and 2020. The WHO estimates that 287,000 women or gestating persons died in 2020, constituting almost 800 maternal deaths per day. What's worse, as many as 80% of the maternal deaths that occur today are entirely preventable. The United States is one of only 13 countries worldwide with a rising maternal mortality ratio, or MMR, and is the only country with an advanced economy where the MMR is getting worse. Naturally, one would want to know why these deaths are increasing, and the factors range from the availability of family planning to fragmented and limited access to care. Only worsening the impact is the fact that disparities exist across race and ethnicity. Black women are almost 4 times as likely to die from childbirth than their white counterparts, while Native women are almost twice as likely to die. Conversely, over the same period, through the adoption of policies that eliminated delivery fees and making maternal health free, Ghana was able to reduce its MMR. Such a complex problem requires a multi pronged approach to find solutions on all levels of prevention, including primary, secondary, and tertiary care. Primary care solutions prevent pregnancy and prepare mothers to achieve optimal health in advance of pregnancy, such as preconception care and birth spacing interventions. Secondary care encourages the raising of awareness for risk signs and additional testing for known risk factors. Finally, tertiary care aims to prevent the maternal death and requires implementation of system level interventions that eliminate barriers and inequities accessing the proper levels of care. Global warming is exacerbating the environmental conditions that impact pregnancy. In Ghana, the evidence of global warming can be found in increased flooding, unusual health, rising sea levels, and drought. In the US, extreme weather conditions such as flooding, extreme cold, and fires provide evidence of global warming. As learning in this field of study grows, it will be important that environmental factors impacting birth outcomes are defined and captured as contributing to the loss of life. At immediate face value, there are stark economic differences between the US and Ghana. The US is a high income country, while Ghana was classified as a lower middle income country since 2010. There are sizable gaps between population size, employment, and education. What's disappointing are the social similarities. In the US, structural biases consistently impact health outcomes as a result of systemic racism, including political disempowerment, segregation, financial practices such as redlining and predatory practices, and the racial patterning of incarceration. Similarly, Ghana continues to experience the prevalence of poverty, unequal access to education, gender discrimination, and income inequality. Health is a basic human right, and standards to provide safe pregnancy, childbirth, and respectful maternal care are rooted in the human rights to life, health, equality, and non discrimination. The right to safe and respectful maternal care should be afforded to every woman. Preventable maternal mortality is a fundamental violation of a variety of human rights, which means with 80% of maternal deaths deemed preventable, maternal mortality in the U.S. is regularly violating the rights of mothers, not to mention the children, husbands, parents associated with every loss of life. In an ideal world, global health initiatives would have all of the funding needed to implement every intervention that is brought to the table. However, because of limited funding, funders have to establish a priority of initiatives to choose from. One such priority is the Population Action, Cooperation, and Equity and Security, or PACES criteria. Some of the federal funding sources include the Title V Maternal and Child Health Services Block Grant, state based Medicaid, and private health insurance. And then perinatal care alone, though, is not sufficient to meet the social needs. So much of what is driven through maternal health outcomes goes beyond the clinical needs and delves into the social determinants of health that families have in accessing care and health related social stressors. Because of this need, it's imperative that we have cross sector partnerships and philanthropic donations to augment the funding from government sources. Some of those foundations include Bill and Melinda Gates Foundation, the March of Dimes, Black Mamas Matter Alliance, Every Woman Counts, just to name a few. In conclusion, global health approach can guide a concerted effort to eradicate preventable maternal deaths throughout for all of the world's people. Improving health at its inception, the perinatal period, has been shown to improve outcomes over the life course. Improving the birth outcomes for mothers will improve the overall health of nations throughout the globe, and it starts by establishing and valuing moms and babies as the priority. Here are the references for the sources that were used to develop this presentation, and thank you for your time. Please direct any questions to me by email. Thank you.